Hi friends, I am Anita, one of the trainers at the ACE campus for English language. Today we will discuss the OET reading part A, which is a tough nut to crack for most of the students because of the time constraints, as you need to complete 20 questions within 15 minutes time. So throughout this video, I will explain the exclusive tips which will help you to complete part A within 12 or 13 minutes. These are the tips which we teach our students at our institute. In part A of OET, you will have 20 questions, and the first 7 questions will be matching questions where you need to match the information in the text with the questions and need to write the name of the text against the questions. So during the exams, what you need to do is that you should skip answering the questions from 1 to 7 first. Instead, you can start answering the questions from 8 to 14 first. After that, you can answer the questions from 15 to 20, and to the last, you can answer the questions from 1 to 7, so that it will be very easy for you to locate the answers within 2 or 3 minutes. So during the exams, the first thing that you need to do on getting the OET reading booklet is that you can start reading the questions from 8 to 14. While reading, make sure to underline the keywords, and you should read the keywords at least 3 times before moving to the passage. Now you can practice speed reading the text. You need to scan across the text for the keywords. For this, you need to practice speed reading skills before the exams. And here I shall provide you with a 30 seconds time to practice speed reading on a text. You can practice reading 2 texts from the reading Snakebite. I hope you have managed reading it very fast. And if you are still lacking it, try to practice more on it. During the time of the exams, you can take up to 60 seconds to read the entire passage. That means you can spend 15 seconds on each text. Each text in the reading passage will be of different context. It can be on the etiology of the condition, on the management, the demographic distribution and advice, or the medical management, and so on. So while skimming across the text, you need to scan for the keywords. Now you can start answering the questions from 8 to 14 first. After that, you can find out the answers for the questions from 15 to 20. Later on, come to the questions from 1 to 7, so that it will be very easy for you to locate the answers for the questions from 1 to 7 within 2 to 3 minutes. That means you can save up to 2 or 3 minutes on reading part A. Now we will practice reading on a text. It will be the reading on the Snakebite. This is the reading on Snakebite, and the 8th question which we are going to do first is to understand the advancement of edema, what should be rechecked frequently. You can mark the keywords, the advancement of edema and rechecked frequently. Now you can move on to the text, where we can see that the answer for this belongs to the text D. After reading the questions from 8 to 14, you should mark the keywords in the passage, and on reading the passage, from the passage you can see that the answer for this question comes in the text D, where it is given: measure, mark and record the circumference of the limb above and below the site. And you need to reassess the limb every 15 to 30 minutes to monitor the progression of edema. So where we can see that the circumference of the limb is to be rechecked frequently. The 9th question is: in which part of world is it important to consider snakebite as an occupational disease? Here the keywords are which part of world and occupational disease. I hope you have already marked the keywords in the text, and once you see through the text, in the reading text A, you can see this keyword occupational disease and Asian region. So you can come to the answer Asia very fast from this. Now let's move on to the 10th question. Which snake's bite causes facial paralysis? I hope you have marked the keywords facial paralysis and which snake bite causes. So causes can be also marked as a keyword. So these can be seen in the text B, where we can see facial paralysis. The information facial paralysis comes under Russell's viper. So the answer is Russell's viper. The next question is number 11. What does not exceed normal limits if the envenomation is mild? So in this question, you can mark the keywords like what does not exceed normal limits and mild. So we can see this information in the text C, where we can see that mild envenomation is characterized by pain and edema localized at the wound site, lack of signs of systemic toxicity, and lab values within normal limits. So I hope you have already marked lab values while you read the text, and which is already marked as a keyword in the text. So it will be easy for you to find out lab values from the text very fast. So the answer is lab values. What is the height to be maintained for the affected limb to minimize the spread of venom? This is a question number 12. I hope you have already marked it in the passage in the text D, where we can see that immobilize the affected extremity in a functional position below heart level. So that means the affected limb should be maintained at a height below heart level. So the answer is below heart level. How frequently is the progression of edema rechecked? Here you can mark the keywords progression of edema and rechecked. And this information can be seen in the text D, where it is given reassess the limb every 15 to 30 minutes to monitor the progression of edema. So the answer is every 15 to 30 minutes. Now we will move on to the 14th question. If the snake bite occurs while sleeping at home, which snake is the main suspect? Here the keywords are sleeping at home and main suspect. So this information can be seen in the text B, where it is given that the snake bite caused by the snake crate causes. Here we can see the answer in the text B, where it is given syndrome 4 paralysis with minimal or no local envenomation bitten on land while sleeping on the ground. It is seen in the snake crate. So the answer is crate. Now we should follow the same method for the questions from 15 to 20, where you need to mark the keywords in the question as well as in the text. So it will be easy for you to complete this very fast. The 15th question is, additional investigations like ECG need to be done based on the dash of the patient. You can see this information in the text D. So here you need to note down additional investigations like ECG. Okay. So in the text D, second paragraph, last line, you can see additional studies may include blood type and cross match, arterial blood gases, chest X-ray, and an ECG depending on the patient's clinical status. So the answer clinical status matches here. So the answer is like this. Additional investigations like ECG need to be done based on the clinical status of the patient. The question number 16 is anti-venin works best if administered dash of snake bite. So from the question itself we can understand that it is something concerning the time frame. So here we can see the information that in the text 4 you can see anti-venin is most effective when given within first 4 hours. So the answer is within 4 hours. Now let's move on to the question number 17. Renal dysfunction indicates that the envenomation is dash. So here the keyword is renal dysfunction and envenomation is. So we can read the text C for this. In the text C we can see that severe envenomation is characterized by petechiae, ecchymosis, hypotension, renal dysfunction, shock and coagulopathy. So the condition renal dysfunction is seen in severe envenomation. So the answer is severe. The 18th question is, it is important to remove jewelry to avoid obstructing dash. This information also can be seen in the text D. In the first line itself we can see the answer. Remove any jewelry and restrictive clothing which may impede perfusion. Impede, the word impede also have the meaning obstructing. So the answer is perfusion. 19th question. The dash of the limb is remeasured once or twice every 30 minutes. You can see the answer for this question 19 in the text D. There it is given, measure, mark and record the circumference of the limb above and below the site. So the answer is circumference of the limb. 20th question. The lab values may not exceed the usual range if the envenomation is dash. You can see this information in the text C, where it is given mild envenomation is characterized by pain, edema localized at the wound site, lack of signs of systemic toxicity and lab values within normal limits. So that means the lab values may not exceed the usual range and the answer is mild. Now after completing the 8 to 20 questions, we can go for answering the questions from 1 to 7. The first question is how to recognize sea snake bite. We need to match the answer with the text. So we can see this information how to recognize a sea snake bite in the text B, where it is given bitten in the sea, estuary and some freshwater lakes. It is a sea snake. Make sure that you already have marked all the keywords in the text. So now let's move on to the question number 2. How often the neurovascular status of a patient should be checked? Here you should mark the keyword neurovascular status in both the text as well as in the question. You can see in the text D it is given that assess the patient's neurovascular status every 15 to 30 minutes. So the answer is D. The third question is the disease condition that occurs due to crotallid envenomation. I hope you have already marked the keyword crotallid envenomation and it can be seen easily in the text C. Now the question number 4. Medications used in snake bite treatment. And in the text D we can see the different medications which are used like tetanus prophylaxis and anti-venin. So the answer is D. Now let's move on to the question number 5. The opinion that snake bite needs to be considered as an occupational disease. And here the keyword is occupational disease. I hope the keyword is already marked in the text A. So the answer is A. Now, the sixth question, the occupations which are most vulnerable to snake bite. And in the text here we can see that too in the first line itself, that snake bite is an occupational disease of the farmers, plantation workers, headsmen, fishermen, snakes, restaurant workers and other food producers. So the answer is A. Now the seventh question, how frequently the affected limb should be reassessed. This information is already seen in the text D, where it is given that the circumference of the limb should be reassessed in every 15 to 30 minutes. So we can get the answer D. So friends, I hope everything is clear for you. I will present you with more videos on the reading part A. Till then, bye.